Hello everyone, the title of this video is Flip the Intraocular Lens, Not the Plan. This video describes a safe rescue for reversed intraocular lenses. The correct orientation of the intraocular lens should appear as an inverse S configuration as shown in this image. Reversed foldable intraocular lens implantation is rare, but this becomes relevant when using premium intraocular lenses where refractive precision is critical. Reversal is often noticed only after the optic of the IOL unfolds. An S-shaped configuration of haptics or spontaneous optic vaulting intraoperatively should raise suspicion of a reversed intraocular lens. The cases demonstrated in this video were performed by resident doctors in training. In such scenarios, the assisting senior ophthalmologist must be familiar with the intraocular lens flip technique to help optimize outcomes. Let us see a few videos demonstrating reversed intraocular lens implantation. As you can see, the resident doctor loads the IOL in the correct configuration. Then, while inserting the intraocular lens, there is inadvertent rotation of the IOL in the wrong configuration. Coming to the second video, again, the IOL is loaded properly, but during implantation, there is inadvertent rotation in the reversed configuration. This is the third case demonstrating intraocular lens reversal. In all these cases, the intraocular lens reversal occurred due to improper implantation techniques by the resident doctors. However, it is important to note that occasionally it can occur even with proper technique. In most cases, a reversed intraocular lens may be left in place without significant visual compromise. This is based on the study by Nava et al., where they studied the dioptric changes in eyes with reversed intraocular lenses and they found no significant refractive surprises. However, if a decision is made to correct the reversed intraocular lens, the intraocular flip is the safest, most efficient option, avoiding explantation and minimizing surgical trauma. Instead of enlarging the wound or sacrificing the intraocular lens, an intraocular flip preserves the small incision benefits of phacoemulsification. Coming to the step-by-step technique of the IOL flip, first we have to fill the anterior chamber and capsular bag with viscoelastic. Then, as shown in the images, we have to use two blunt instruments, that is, two Sinskey hooks anteriorly and posteriorly. Then, we have to perform a controlled 180-degree flip in anti-clockwise direction akin to flipping a coin. This technique was first described by Kang et al. And it was published in the British Journal of Ophthalmology in 2003. Now let us see a few cases where the intraocular lens flip technique was performed. As you can see in this video, the intraocular lens is implanted in the reversed configuration. Then the anterior chamber and the capsular bag was filled with viscoelastic. Then two Sinskey hooks were used anteriorly and posteriorly and the intraocular lens was rotated 180 degree. And now the intraocular lens is in the correct configuration. This is the second video demonstrating the IOL flip technique. The intraocular lens is implanted in the reversed configuration by a resident doctor in training. The senior ophthalmologist takes over and fills the anterior chamber and the capsular bag with viscoelastic. Then two Sinskey hooks are used and the intraocular lens is rotated 180 degree in anti-clockwise direction to place the IOL in the correct configuration. Some of the things to note are the intraocular lens flip technique is only for soft foldable intraocular lenses and it should not be used for rigid PMMA lenses due to risk of zonular or capsular trauma. This technique is especially significant when there are significant diopter shifts in premium or high power IOLs which necessitate correction. The flip maneuver is reproducible even for first time users with low risk if capsular integrity is intact and anterior chamber depth is sufficient. So the take home message is instead of explanting a reversed intraocular lens, flip it. This is a minimally traumatic solution that turns an intraoperative complication into a confident recovery. Thank you.